Dr. Anil Sharma, and I'm a consultant surgeon at the Max Institute of Minimal Access Metabolic and Bariatric Surgery at the Max Super Speciality Hospital at Saket in New Delhi. We will speak a little about Gastro Esophageal Reflux Disease. This is commonly also known as heartburn or regurgitation, and the symptoms that are commonly associated with GERD or gastroesophageal reflux disease are, like I said, a constant sort of a heartburn, a retrosternal pain, and these symptoms seem to get worse at night, so much so that some patients cannot sleep flat in the bed at night and need to in fact raise the bed. This seems to be a fairly common lifestyle affliction these days, and we see quite a number of patients with these symptoms in our clinical practice. We in fact make a diagnosis from the symptoms of the patient and from a few tests, the most important of which would be an upper GI endoscopy, which confirms the finding of gastroesophageal reflux disease. The management of gastroesophageal reflux disease is basically of two types. We have what we call medical management and surgical management. Now, as far as medical management is concerned, this consists mainly of lifestyle changes, and some of the most common lifestyle changes are to have your meals at about 7 or 8 o'clock in the night, so that there is a gap of about 2 or 3 hours before you go to sleep. The type of food that is eaten, one needs to avoid the fried foods and a lot of spices in diet. And there are some medications that we give to in fact provide the so-called medical line of management. And when our medical line of management fails, there are a few patients that would require surgery. And surgery, we in fact perform a procedure that is called laparoscopic fundoplication, wherein we sort of recreate the gastroesophageal junction. It's a fairly common operation and quite successful too, because 90% plus of patients would be actually relieved of their symptoms with surgery. This in fact requires a couple of days stay in the hospital only, about 4 or 5 small incisions on the abdomen, and it can be done in places which have a certain degree of sort of expertise and experience with advanced laparoscopic surgery.